Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of Muscle Care. I see 55,000 patient visits a year in my practice. We understand pain. If any of your friends or family suffer from hip pain, please give them this mini series of stretches. It will help dramatically. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that we're warm, let's get relief from our hip pain. What we're going to do now is a torso stretch. Hips should be right under the shoulders, ears should be right over top of the shoulders, and you'll do a torso stretch. You can hold your hips and just twist the spine and the neck all the way up to the top in rotation to the left. Do not move your hips. As you've done this stretch and you've held it for 30, then for more stretch, you can turn your pelvis further to the one side. Do both stretches equally on both sides. For the side of spine, make sure that you actually open up your legs. They're wider than shoulder width for stability. Put your left hand on the left side of your lateral left leg or hip. The right arm goes straight up in the air and you lean to the left side. So your right arm should be pointing to the left and it should be straight all of the time. Do both sides exactly the same. Now, for the front of leg or quadricep, we call it stretch. What you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight, you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. To effectively stretch the middle calf, you lean onto a wall or a post, and what you want is your left leg forward. So the left foot is pointing forward, the left knee is bent slightly, probably about 30 degrees, and then the right heel is placed back behind your body. Always keep the right heel on the ground, and then your hands are on a wall or a post, and you lean forward. And what that does, you lock your right knee out. You keep it in extension. You don't lift the heel off the ground. Your right foot must be maintained pointing forward so that we get a perfect mid-gastroc or calf stretch. And then by keeping our knee locked in extension, we stretch out all the connective tissue and the fascia behind the knee, which is where a lot of us build up a lot of tension. For an effective side of leg stretch, remember that the iliotibial band, tensor fasciae lata, very, very, very tight adhesive sort of tissue, because that stabilizes your pelvis so you don't fall over. So those stretches take a little longer and you've got to be patient. So you stand facing away from a wall, put your left hand on the wall, and what you'll do then is support yourself. Now your left foot stays planted on the ground. Your right foot crosses in front of that left leg. And then what you'll do is your right hand goes on your right hip and that pushes the hip toward the wall while you're stabilizing and holding the wall. This way you're going to be stable and you're not going to fall, but you're going to have to breathe deeply for at least 30 to 60 seconds. Notice I said 60 because fibrous tissue doesn't have a lot of blood flow. Blood flow brings magnesium into those tissues and helps them relax. So again, it's going to take longer than an average muscle. Do both sides. You can do this standing or lying down, but if you're going to stand, hold a chair, lift up the right knee to 90 degrees so that the thigh is parallel to the ground, and grab that right knee with your left hand and pull it so it rotates to the side. Try not to twist your upper body. Try to keep your upper body straight ahead, ears over shoulders, shoulders over hip, and twist to the side. You can do this lying down as well if you have balance issues or dizziness problems. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? Muscle Care is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're going to love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.